Hi everyone, and welcome to Practice Growth HQ. Now, today we're going to talk about the ever-changing nature of healthcare education. Look, this we all know. If you're a healthcare professional in Australia, you must do a certain number of hours every 3 years, I gather, is the typical period. And the one thing that we know about healthcare education in the various fields is that it keeps changing. And so for that reason, we've got my guest today to talk about how to get the best out of the education sector. And I cannot think of a better person qualified than Abby Corrigall. Now, Abby started as a dental assistant working in a dental practice, I don't know, scalpel, etc., whatever the dentist was asking for. She then worked as the general manager for the Australian Dental Association, the New South Wales branch, and is now the CEO of Enzo 4D, which is heavily in education services, lectures, even healthcare models, all the way from Sydney. Welcome, Abby.
Thanks, Angus. Thank you for having me.
All right, Abby, we'd like to start with a fast five, kind of quicker questions, quicker answers, so people can get to know you quickly. Question one, where did you grow up?
I grew up in a very small town called Alexandra in New Zealand.
Question two, favourite book besides your own?
I would say probably Never Split the Difference by Chris Voss.
Yes, that's a very interesting book. He's former FBI negotiator, if I'm not. Yes,
Yep.
no, I have read that book. Yes, it's fascinating learning about negotiation tactics. Question three, Abby, what's one of your superpowers?
Juggling a lot of balls, I think, in the air at once.
Okay, all right, there you are. Task switching, I gather they call it. I think multitasking has been poo-pooed by the experts now. They tell us it's actually not possible biologically, but task switching is what you're describing. Well done. I think you're a mum too as well, aren't you? So dare I say we throw that into the mix?
Yes, that's the biggest ball of all.
Indeed. All right, Abby, now look, you're a very fresh-faced young thing, but question four, something you wish your 20-year-old self knew. For some of our listeners, being 20 was a long, long time ago. For people like Abby, it wasn't necessarily that long ago, so you can understand why she's deliberating on this one. What's one thing?
That's a tricky one. Look, I'm still constantly surprised every day. Like if you said I'd be doing this 20 years ago, I possibly wouldn't have believed you.
Every day is a new opportunity, perhaps.
Yeah.
Yeah, well done. Yes, and I will tell you, listeners, I had to work pretty hard to get Abby onto this podcast. So you should savor every word. Question five, something you're grateful for.
I'm grateful for my family. Yeah, definitely.
Well done. All right. Well, as I alluded to in the intro, the truth is that every healthcare professional needs a bunch of education. One, you must do it, although I don't necessarily think that's a great reason for doing it. What I'd rather see for the listeners of Practice Growth HQ is that they're highly strategic about the education that they do because it can help you grow your practice. Now, Abby has been in the education space a long, long time. And there are big, big changes. Tell us about what's going on.
Look, I think the sphere has definitely changed over the last 15 years. 15 years ago, there weren't that many providers of education. You looked to the association or the universities for continuing professional development. Now, these days, there's a lot more industry education, and there are a lot more private practitioners who are going out on their own to provide education.
So what sort of checks and balances are in place, if any, in relation to this?
Now, that's the interesting piece. Clinicians have to decide themselves what is classified as education.
Okay.
Clinicians will know that they have to complete 60 hours of education every 3 years.
Yep.
80% of that should be scientific and 20% of that can be office-based.
Yep.
So it's really up to the clinician to decide where they sit on that kind of spectrum. And there's definitely education out there that is slanted slightly more commercial.
Yeah. Okay. So I guess I just wonder, for someone who's here, they go, hey, Angus, like, why are we even discussing this? I've been doing CPD for years. And the reason we're discussing this is because this is a chance for you to do this a bit more strategically. Now, Abby's expertise is in this space and indeed the changes that have been happening. I guess I just wondered if someone's listening going, you know what, I know I want to grow my practice. I'm thinking about taking a course that's going to help me maybe do some extra things clinically. quickly. I mean, how do the listeners figure out what's a good course to do versus not?
Look, I think they need to sort of be fairly self-reflective when it comes to the education journey. If there's a particular area of dentistry that they like, and you could look at specializing, or you could look at doing a couple of courses in that particular area to improve. If you wanted to look at something more generalized, the ADA CPD program guide is excellent for general single day courses. It also comes down to how much time you've got available to dedicate to the education, because there's a lot of courses out there that you can do that are modular or university based. So that they could take upwards of 18 months to complete.
Yeah, look, my impression is most healthcare professionals actually do way more than the minimum amount of CPD, as you said. So, what did you say, 60 hours in 3 years? Is that correct?
Yeah.
Okay.
Yeah. There's definitely a spectrum of clinicians out there. There's the diehards who go to much, much more than they need. And then on the other end, you've got the clinicians that wait until the very last minute and get as much in before the deadline.
Yeah. Now, look, I'll ask you a question that I have some views on myself, but I'm interested in yours. I mean, if we've got listeners here, you've been in the education space a long time. Like, if we've got listeners here that are like, I want to use education to maximize the growth of my business, what guidance would you give them?
I would look at, in terms of growth around the business, I would suggest choosing your path, deciding on where you want to be and what particular area you want to be in, and then really focusing on that.
Well, within dentistry, there are many fields that are not, I mean, the general dentist, for example, there's lots of different things they can do, which is, in a sense, it's kind of like a quasi-specialist. You don't have to be an orthodontist to do orthodontics in Australia. This is true in physio, it's true in medicine, although I noticed, generally speaking, doctors are less inclined to do this. They're more likely to send people to a specialist. But you certainly get GP doctors who have got a particular interest in a certain area. My grandfather, Abby, was delivering babies. He wasn't a gynecologist, but he did a fair bit of that. All right, so choose your field. What else would you say in terms of how they access education?
I think in terms of accessibility, there's a lot of options out there online that you can be doing, webinars, podcasts, that sort of thing. It comes down to lifestyle as well. Maximize the opportunity that you've got to do CPD. So if you have a commute every day, there's a lot of podcasts like your own that you can listen to. Breaks, you can watch webinars.
And certainly it's not unusual, and I know it can be clinical and non-clinical. It's not unusual for industry to say, why don't we come and do a lunch and learn, and we'll, take you through whether it's a piece of technology or some sort of new clinical paper or some kind of business thing. I know some of the dental magazines, it's like literally read this article for X number of hours of CPD. So there's lots of different options. Look, let me give you my 2 cents here. Abby's background perhaps maybe slightly more on the clinical focus, but I know at ADA you certainly had a bunch of non-clinical stuff as well. So the requirement is minimum 80% clinical, is that correct?
Yes.
Okay, all right. I would say for most of the listeners, if you are interested in growing your practice, then I completely agree with Abby. Like, choose a field. I say speciality rather than specialization. You can't call yourself a specialist. APRA won't be happy with that. In every medical field, there is a particular path that you can go down where you say, Dr. Abby's got a special interest in ... We're not saying that Abby's an orthodontist, if she's not, but you can have that special interest. And the other one I have to say is a bunch of CPD in relation to business skills. Every healthcare professional I've ever met has said to me they have not had one iota of business training during their degree. It is 99.999% clinical. And if I've learned anything in business over the past 15 years, like, I don't think we're born with the gene of business skills like you. It's learnable. It can be learned, same way as your profession, but going and getting that education makes a big difference. What other sort of changes have you seen in the education space? And if someone comes to you, maybe they meet you in a social context and they find out what you do and they're like, oh, maybe it's like a grad and they're like, help me, Abby. I've got this, it's kind of this minefield. I'm a bit more of a proactive healthcare professional. I'm not going to wait till the last month and then jam 60 hours in. What advice would you give?
Yeah, look, I do feel for the clinicians coming out these days. Obviously, the practitioners who went through COVID would have had a fairly jarring experience at university compared to their older peers. I think for those guys, it's just as much hands-on time as possible that you can get
Mm.
in the clinic, learning from your peers and colleagues, asking lots of questions, doing lots of preparations, and maybe perhaps going to networking events. There's a lot of geographical based dental meetings where you can learn. They do evening lectures, weekend lectures. You get to ask a lot of questions of other clinicians in the area.
Yes, it's kind of
Yeah,
inevitable. If you're in a room with a bunch of healthcare professionals that are same as you, it's inevitable you're going to talk about your profession, aren't you? Because that's the one thing you've got in common with each other. What about kind of traps? What would you say in an education space? It's like, oh, look out for.
I would just be cautious of weekend warrior programs where people purport that you're going to be able to do X, Y, and Z by the end of the weekend. Some courses do need time to teach. So I think that would be my only.
Let me echo that. I've worked very closely with a number of educators in healthcare, and by virtue of my marketing background, I've interviewed personally, for purposes of a testimonial, dozens and dozens of healthcare professionals. And the thing that I hear that healthcare professionals want is they want support, which is, as you say, it's all very well to go and do a 2-day course on a weekend, but then what? And if I think about all the healthcare professionals I've met that have gone and done a course, maybe bought a piece of equipment or whatever, and if you were to go and survey them 3 months later, 6 months later, in many cases, nothing's happened, which is they've gone and learnt that, and maybe they've come away and they've gone, I wasn't sure if I was interested in that speciality or not. And having done the course, I know I'm definitely not. It was a bit like me doing law in my MBA. It was like, thank you, I appreciated doing that unit of law, but no, I do not want to be a lawyer. But I just know with the people that I've worked with, where you can have a program that's got an ongoing part to it, I think that makes a huge difference, where you've got some support from a mentor. Because as you say, you could go and sort of cram for a couple of days and learn some stuff, but you get back to the practice, are you going to implement, and what's the process that you've got for doing that? Certainly that support's really important. I think the hands-on, if that's possible, depending on the kind of course that you're doing. One of the clients that we work with, they take people overseas, and this one, for example, is dental implants, and the students will place a dozen implants in a week. So they've gone from a very basic level of understanding of implants, and by the end of the week, like, they've done a dozen, which means that when they get back to the practice, they are armed to know, okay, this kind of case, I've already done a bunch of those, and therefore it's not difficult for me to say, yes, that's within my control. What you wouldn't want is to, yes, go and do this weekend course, leave there feeling like you know about 50%, and then come and have a crack at something, and then suddenly things are not working.
Correct. Yeah. A program that has a follow up mentoring aspect is good.
Now, Abby, we should talk about, as your role CEO of Enzo 4D, one of the things that you guys are involved with is healthcare models. And these can be very useful for showing patients, hey, Angus, here's what's wrong with your knee or your lower back or your elbow or your crown or whatever. Tell us about that space.
Yeah, absolutely. So we have a company called Oratomic 4D, and we create biomimetic 3D printed patient models. So for education and training purposes, we have a series of patient models. They're based on real, actual patients, and they're very cool, I must say. They're the reason I jumped across and started working over here. I had a little bit to do with them when I was at the ADA, and we were using them for our oral surgery courses. And I sort of gave them some feedback about some changes that had to happen, and then I got offered a job.
Wow. I'm curious. I mean, are you allowed to say what feedback you gave them?
Oh, it was just around the brackets, actually, for how the patient model sat at the desk so that the
Oh,
participants could use it. But we have extraction models, we use those for oral surgery, we have endodontic models, pediatric models, edentulous models for training, implant training, and they're true to life. So one of the long-term problems that I used to face at the ADA was, trying to source cadavers for those programs or finding pigs' heads. And these models were the perfect in between because they are based on real life patients and they're just a little bit less to clean up at the end of the day than what a pig's head is.
Yes. Is that the exclusive domain of dentists, pigs' heads?
Look, I think there's probably a lot of other people using them. When I first started at the ADA, we were getting those pigs' heads for about $2 a head. And then as the word got out there, I think people are paying about $25, $30 a head these days for the pigs. So Chinatown is making a tidy profit on the pigs' heads from the dental industry these days.
There you go. It's like trash and treasure. One man's trash is another person's treasure. How interesting. What's been your reaction when you've told people outside the industry that the dentists literally learn and play with pigs' heads?
Look, my friends aren't surprised anymore. Like I've always had a job that's always a little bit interesting, but yeah, no, I think they're enthused to see that we're actually working on real life patients. Yeah.
Yes, as I said, I know from personal experience a number of the educators that we work with, and the way they do this, and I'm going to be very careful what I say here, because I'm not in any way contrasting pigs' heads and real humans, but one of the things you can definitely do is go and do courses, for example, in developing nations, where the people involved, they wouldn't be able to afford the treatment otherwise, and so they're prepared to go and be a guinea pig of sorts. This is ethical treatment, just to be super clear. We're not harvesting organs here, listeners. It's sort of a win-win situation. For example, I mentioned one of them was dental implants. And so they'll go overseas, they'll place a bunch of dental implants on live patients, on patients who otherwise couldn't and wouldn't get that treatment, too expensive. So the patient gets the benefit and then the dentist gets the practice as well. I'm just curious with the models, is it as simple as, dare I say, kind of order one off the internet, it arrives, and then you just start talking to people? Do you coach the practitioners in how you would use this model when you're talking to patients to sort of for best impact?
Well, I guess the models have got two roles. So we sell the models to universities and training facilities. We're working with a number of different universities on custom models for their training and education needs. And we also run a number of our own courses using the models. The beauty of the models is because you're getting the entire patient, you're practicing during the course on the hands-on, and then you can take the model home and either continue to practice or have it as a focal point of the surgery to say, well, this is the type of treatment that you're going to get done. This is what we've been working on. And it's a great tool to show patients what a crown looks like, what a filling looks like, what a bridge looks like.
Yeah. And dare I say, Abby, particularly for patients like me, my spatial skills are quite poor. Like you could vividly describe something to me and I've got no idea what you're talking about. But once you stick a model in front of me, I go, oh, okay, I can see how that works. And I can see why this is necessary. What an interesting space. Well, look, Abby, I really appreciate your time today on this kind of unusual topic, but it's fair to say this is important for the listeners to really be maximizing this space. I was actually at an event recently, and one of the things I noticed was we had a number of clinicians speaking about sort of how to do this particular field, but also we had a clinician talking about how to communicate with patients about it, because as one of my former guests on the podcast said to me, there's a whole stack of treatment in healthcare. Some things it's like if I can't get out of bed or whatever, well, that's pretty important. If I can't do my job, that's important. But there are lots and lots of things in healthcare that are basically elective. And so that education piece is really important. The communication piece is really important and needs to be an important part of how you set up your practice so that you can help yourself grow. Abby, well, thank you for that. So if people want to learn more or get in touch, what should they do?
Thanks, Angus. I think if anybody wanted to get in touch, I'm on LinkedIn. That's probably the easiest way to reach out and say hi. Always very happy to chat.
So it's Abby, Abby, surname Corrigall, Corrigall. And tell Abby that you heard her on Practice Growth HQ. Abby, once again, thank you so much for your time.
Thanks, Angus.
All right, everyone. Well, we've covered a bit there, haven't we? And as I like to say every week, it's not knowledge that's power, it's applied knowledge that's power, which begs the question, what's one thing you picked up from today that you can go and take action on? Finally, if you got some value from our time together today, then please head to where you heard this show, leave us a review to give us the encouragement to bring you more great content every week on Practice Growth HQ.